Hi, Dr. Minkoff here, LifeWorks Wellness Center. Today I want to talk about cancer. It's an epidemic in our society right now. It's the second leading cause of death, according to the National Institutes of Health, and it's really a problem. Back about 35 or 40 years ago, when Nixon was president in the early 70s, he declared a war on cancer. And the war on cancer was to put enough government resources into science and technology to be able to actually solve the problem of cancer. Now, I'm going to show you this graph, which you'll be able to see better. And what this is a graph of new cases of cancer from 1900 to 2000. If you look at this graph, what you see is, in 1900, the number of new cancer cases started to go up until about 1970, which started the war on cancer. And in this book it says, War on Cancer. This graph goes almost vertical with new cases of cancer and number of people who have died with cancer. So if anyone would look at this and say, how are we doing with prevention of cancer or with effective treatment of cancer, based on this graph, we would say that we're not doing very well. Now, this is from a book by Charles Simone. He's a medical doctor, he's a medical oncologist, and the data that he's collected is from the National Institutes of Health. So this is quite reliable data. When I look at that, and then I see cancer patients come into the clinic, what I know is that I have to treat them differently than they're being currently treated, because that method of treatment is not being very successful at curing or preventing cancer. So here at LifeWorks, we have an approach where we are looking at people, and what we know at this point is that cancer is caused by a problem with the energy generation system in the cell. This is a small part of each cell called a mitochondria. In an average cell, there are between 1,000 and 2,000 of these in the cell. In the early 1930s, Otto Warburg, who is a medical doctor and PhD in Germany, figured out that when a cell becomes cancerous, these mitochondria stop working. And when they stop working, what that means is the cell is unable to use oxygen to generate energy effectively. And the cancer cell, as a way to survive, starts using energy without needing oxygen. This is called fermentation. It's called anaerobic metabolism. Anaerobic means not using oxygen. And that's the difference between a cancer cell and a healthy cell. In order for a cancer cell to grow then, using anaerobic metabolism, it needs to have a very high supply of glucose, of sugar, of carbohydrates. When we approach cancer, now why does the cancer cell get this way? It gets this way because the mitochondria become poisoned. Now in our environment there's over 80,000 chemicals, heavy metals, pesticides, viruses, parasites, fungal toxins. They're in our environment, they get into our bodies, they get into our cells, they get into the mitochondria, they make the mitochondria so it's not functioning correctly, and that's the origin of cancer. What could we possibly do to try to help people better? We have to reduce the number of toxins that are coming in. We have to unload the body from the toxins that it has. We have to starve the cancer as best we can with low carbohydrate, low sugar diet, low protein diet. And then we have to have effective things to give to the body, herbs, low-dose chemotherapy, hyperthermia, in order to try to attack the cancer cell without reducing our own immune cells to try to get the cancer to go away. One of the dirty little secrets about chemotherapy is that the stem cells, the very cells which started the cancer in the first place, are not killed by chemotherapy drugs. So you can't generally solve cancer by just trying to kill everything in sight. Because when you kill cancer cells using high-dose therapy, you are going to also kill your own blood cells, your white blood cells, your gut lining cells. Your hair's going to fall out because these cells are growing fast. And the chemotherapy drugs kill cells that are growing fast. So what we're trying to do here at LifeWorks is use some things that kill, but in low dose, and then try to support the immune system with substances that we know can build it up or make it work more effectively, so that we get a balance of healthy immune system, cancer cells stressed out, in order to help the patient heal. Now, this isn't a panacea. Cancer is very challenging. Trillions of dollars have been spent to try to change the curve of that graph. We think that if we use this combined method, that we can get our own immune systems to help us to heal, that it gives us a better chance. So in every patient that I see, what I say to them is, we're going to do a couple-month trial to see if this way of looking at cancer and addressing cancer will work, and we'll do our scans up front, and we'll do them at the end of it, and we'll be able to see, yes, this seems to be working in your body. We can keep going. Or, no, this doesn't look like it's effective in your body. We have to resort to some other method of treatment. So I hope this gives you kind of an overview of what our approach is to try to help people with cancer get better and survive longer and have a higher quality of life. Okay? Hope this helps.